All right, well, I want to welcome you here tonight. We're going to teach a seminar in our series called How to Have a Happy Spine. And this one is geared to a lot to prevention and also to curing or fixing up your back and your spine. I've learned over the years that a lot of people's problems were avoidable, for starters. And it's great to avoid problems rather than have them. And then if you actually get into a position where you have problems with your back, as many people do get there eventually, then you want to know how to fix it. Then once you've fixed it, you better know how to keep it fixed and maintain it. So all of that is the purpose of tonight's seminar, is to cover those types of things. I think probably one of the best analogies for your back is one that most of us can relate to, which is to our teeth. I think most of us have learned, hopefully not the hard way, although some do learn it the hard way, that it's better to take good care of your mouth than have it fall apart. It's better to learn how to do the right hygiene and have your mouth hold together than to end up with a bunch of cavities and crowns and root canals and pain and expense that you don't need. And of course, you can show up with a horrible mouth at a dentist's office and spend $15,000 and have them reconstruct the whole thing, and the money's fun to spend, and the time in the chair is, you know, amongst some of the most exciting recreational time you can spend. The problem that happens with your spine, with your back, with your vertebrae, is that when it decays, when it degenerates, you don't really get to go and get new ones put in. They haven't figured out how to do that. You know, you can replace teeth and put in crowns and caps and thises and that's. But when it comes to a decayed spine, when you finally let the thing go to hell in a handbasket, who's going to go in there and replace it? And the real problem is that spinal degeneration is like tooth decay. It's something that can happen to anybody, and it can eventually wreck your life. And you really don't get the option of ordering a new spine at this point in time. That technology does not exist. So knowing how to prevent, knowing how to correct, and knowing how to keep the one spine you get per lifetime is way ahead of spending your life, you know, crippled and messed up. And people really do get crippled and messed up, largely because they didn't know what they needed to know. You know, really, the truth is the one thing that can save you a lot of grief. Knowledge is the one thing that can prevent you from coming to a lot of grief. And tonight I'm going to try to impart the most important knowledge across the boards that I could give to anyone about how to prevent problems, fix problems, and understand how to maintain and take care of yourself. Now, one of the topics that I cover only in this seminar we're going to get into next, and it's the topic of your discs, disc injuries. And discs are important. Most of us probably never realized we ever had any. And probably the only ones that ever figured out they had them are the ones who damaged them. And boy, do they wish they didn't. What are discs? They are these pads between the vertebrae. These are models of discs between the bones. When you look at two vertebrae and you see this cartilage pad that acts as a shock absorber between every two bones of your spine, that's called a disc. And discs are important. I'm going to go through what they are and what they need and what they hate. Because I'll tell you, and there are some people in this audience who will jump up if they could jump up easily and tell you you don't want to injure your discs, because this is not a fun deal. I know there are at least two people in this audience who have the most severe disc injuries you can get into, and it changes their lives around. Well, what is a disc? Basically, you've got this thing we call a disc, and it's sandwiched between two vertebrae. So you got a vertebra and a disc and then another vertebra. And discs, by and large, are made up of two types of material. They're made up of these crisscrossing, helter-skelter fibers. For those of you that were at our injury seminar not too many weeks back, we talked about the human body's use of white fiber tissue for so many things. to make ligaments and to make tendons and to hold things together. That same material, we find it again in the discs of the body. This white fiber tissue is the outer portion of the disc. And inside every disc, sort of like a Dunkin' Donut jelly filled, there's a jelly ball bearing that sits in the center of the disc. And this stuff is a gel. It has the texture typically of toothpaste. And it forms a round ball bearing within the fiber structure of the disc. What's that all about? Well, the discs do a number of things for us. One thing they do is they allow you to move, because these vertebrae move against one another. But if they were bone just sitting on bone, supporting the whole weight of your body, by the time you danced for an hour, you'd be a bunch of bone shavings, you know, and they just sweep you off the dance floor and mail you home. So that's not how your spine is built. Your spine is built with shock absorber pads between every bone so that as you move, there's something that allows movement to take place. I said the word shock absorber. They are that as well. They're shock absorbers so that when you run and move and jump, your discs keep bone from just slamming into bone. They have a certain amount of springiness to them. This hydraulic system of having the gel in the center and these moist fibers on the outside and forming this pad between every two vertebrae gives us shock absorbing ability. And of course, so that you can have rotation, and you look at the ball bearing there, and it also allows you to have bending action. So that when you go and side bend or forward bend or back bend, these bones are going to play off that gel ball bearing in the center. And you use ball bearings in manufacturing. You want to have some roller skates turn nice. You want to have a motor turn nice. You put a ball bearing in there and things can move. And the design of the human body is you have a ball bearing. It happens to be made out of a gel material, not stainless steel, that sits in between every one of your discs. Now, people can hurt their backs in various ways. You can get a vertebra to twist and misalign and cause a vertebra to twist and then pinch a nerve where the nerve comes out between two vertebrae. And that is a very typical thing for chiropractors to deal with, and to deal with better than any other profession, because we're one of the only professions, and really the only one in America, that studies how to realign vertebrae that have misaligned and pinched a nerve. That's sort of the most basic job of a chiropractor. If you wanted to just say, what basically does a chiropractor do? Find where bones are misaligned, unpinch the nerves by lining them back up again. That's sort of your most basic definition of the job. Can you do things to the nerves that are beyond just misaligning the bones? Yeah, you can. You can hurt a disc. And this is where you start getting into more serious trouble. There are different grades of how discs get hurt, and let's just cover them because they're worth knowing about, and we'll cover how to prevent them and how to fix them also. When a vertebra misaligns with another vertebra and the disc becomes deformed, in other words, it's wedge-shaped now instead of flat, that's going to cause some pressures onto a disc. For starters, every time you bear weight, what's going to happen to that gel ball bearing in there? It's going to start being shoved to the open side of the wedge. It's going to start being squeezed out. And that's the first level of a disc screwing up, is when a vertebra misaligns with another, it will start to deform the disc and start to push it into places it doesn't really want to go. What's the next level? Well, the next level is some of these fibers begin to fray and tear and just get torn up. Why? Because you hurt your back and the thing's wearing. Maybe your nutrition isn't great. We'll be talking about that tonight. And these fibers are not well nourished and they're more fragile than they should be. You know, you run into some people that end up with multiple disc injuries, and what's going on with these people? Sometimes their nutrition is so bad that they start injuring multiple discs, not even just one. But this would be the next level. We've got a bulging, a bit of a deformed disc. It starts to bulge a little bit, and that bulge can begin to push against a nerve. Sort of the sad feature about discs is this. Your body has a huge plane of white fiber tissue running down the front of your spine, and it has a huge plane of white fiber tissue running down the side of your spine, so that when discs begin to go out of place and get jammed out of place in the various ways we're going to discuss, they seldom end up going where they would do no harm. They can't go forward where they can't bump into a nerve, and they can't go sideways, which they wouldn't bump into a nerve if they could go in either of those places. Instead, they end up going backwards or backwards and to the side, in which case it's either going to jam up against one of these nerve outlets and hit a nerve root, and that can give you hell, or back up against the spinal cord, which sits inside the spine here, and push right against the cord. And unfortunately, the only two places the discs end up going are the two places you don't want them to go. Typically, they'll end up going against the nerve elements, either against your spine or against a nerve root. So we end up with a bulging disc. Then we can end up with a disc that starts to bulge and then fray. And then you can end up with a disc that begins to really get into the most serious nature of disc injury. Now the fibers have frayed so much that the gel is being squeezed out of the disc and now begins to leave the fiber container, the fiber outer portion, the basket that should be holding that ball bearing into position. And when that occurs, that gel is now moving out of the disc, and where does it end up? Like I just told you, where you don't want it. It most typically will end up against one of those nerve roots, like if it's one of the low back ones, it can be a nerve that shoots down a leg. Or bad also is to have it shoot back against the spinal cord and actually compress the whole nerve cable. The first seminar in this series, I explained some things about nerve compression to you. Let's re-explain them because they still apply very much with discs. Nerves hate to be pinched. They hate to be pushed on more than you could imagine. Nerves do not like to have pressure on them. We know from study of nerve physiology that the lightest touch that you can apply to a spinal nerve, and try almost not to touch someone, just several millimeters of mercury pressure, which is almost nothing, will stop 50% of a nerve's ability to carry signals. So whenever these disc bulges or squeezed out gel lands against a nerve, a person typically enters a nightmare world. They really are in a horrible state because the nerve is being pinched dramatically when that happens, and they get into a lot of pain. The final and worst of these, the third one I just showed you there where the gel starts to come out, is called a herniation. So now you got a herniated disc, or the word can be used ruptured. Both mean the same thing. A herniated or ruptured disc. Now a hole's been ripped in the fiber tissue. The gel is squeezing out toothpaste out of the tube, typically against a nerve element, typically making a person very, very unhappy beyond belief. Sometimes like put a gun to their head beyond belief, because they typically get in unrelenting pain. They're in pain standing, they're in pain lying, they're in pain no matter what they do or don't do. And eventually pain like that, severe nerve pain that doesn't want to leave you alone, can make you nuts. Would any of you with disc injuries raise your hands and say, is that true? Hallelujah, that is true. I mean, it's like crazy, isn't it? I will tell you that disc injured patients get desperate. I mean, if you were selling bridges, if you were selling, real estate underwater, you could sell anything to a disc injured patient because they are desperate for relief. Anything, just anything, just do something is where disc people get with severe disc injuries. The fourth and last gradient of this injury is to have the gel now extrude out of the disc and a fragment of it break off from the mother piece of the disc gel and now have a free-floating fragment of disc gel sitting usually where you don't want it, right on a nerve or right on the spinal cord. That one becomes important because as we talk about fixing these, and this is where you have a free-floating gel fragment This is the toughest one for anything natural to deal with, as we'll learn in a moment when we learn how to fix these. How is it that anybody ruptures a disc? I mean, it's not hard to get one bulging. All you got to do is get your back twisted or lift a little wrong. Even fray it over time, you know, start to fray a disc. But how is it that people end up completely blowing out a disc and ending up with a disc herniation or a disc rupture? Well, one of the best ways you can really ruin your life is to lift incorrectly. How many of you don't think you know how to lift correctly or don't do it all the time? You need to know how to lift correctly, and you need to do it all the time. Because I have met so many people over the course of my 20 years in this career where one stupid lifting mistake changed the course of a lifetime for them. And here's what you need to know. When you bend over from the waist to lift something, you're doing a very bad thing. When you bend your knees, get close to a load that you can manage, and lift with your legs with your spine straight, that's the only way you should ever lift. The reason is this. They lost my page with all the statistics. I'll do my best to remember all the numbers for you. But basically what it is your spine acts like a big pump handle. And the unfortunate fact is, you know how a pump handle works. You got a pump and you want to pump water out of a well, and you get out on the end of this handle and you go like this. And suddenly you can use your body to lift water from 50 feet under the ground. Whereas if you got up by that pump and tried to pump it up here by the pump itself, you can't do anything because you're using something called leverage. You begin to expand the force you apply by having this long arm on your pump. Now when you bend over from the waist, you use your arms as leverage to apply all the weight to the bottom discs of your spine. You see what happens? It's just a pump, and it pumps right down on the discs. I don't remember right off the top of my head all the statistics, but I'll tell you the bottom line on it. You add 15 pounds per square inch for every pound you pick up when you bend over and lift like that. 15 pounds per square inch is added for every pound you pick up. And discs blow out typically sometimes around 1,000 pounds per square inch pressure. And if I remember right, standing around you got about 237 pounds per square inch inside of a disc. And it goes up to 350 when you try to go to the bathroom and sit on a toilet, which is why disc injured people have such a hard time going to the bathroom, or coughing, or sneezing. But when you go and bend over and lift up 50 pounds and increase the pressure within that disc by 750 pounds per square inch, you start hitting the blowout point. Too much air in the tire, too much pressure, you're going to blow the thing out. Try getting 100 pounds. Try having the thing be stuck. Maybe it's jammed into a corner. Have it be a wiggling kid that's trying to get away from you and is pulling. And suddenly you can have something that's stuck there. You may give a sudden impulse where you're adding more than the thing even weighs. And the pounds per square inch inside that disc is enough to completely blow it out. And then a person gets into one of these disc herniations. It's a very frequent way to get there. It makes it one of the most common work-related injuries in America. It's interesting to note that the #1 group for disc injuries are truck drivers. But you know the #2 group most common for disc injuries are housewives. Why? Because they're around the house lifting stuff and lifting kids, and they blow out their discs. Now you might think, well, wouldn't it be old people that end up with herniated discs? And the answer is surprising. The average age of a person who goes into disc surgery is 29 years of age. It is actually a younger person's injury. The reason for this is the white fiber tissue, the crisscross stuff, is very absorbent. It's very richly supplied with fluid. It's like a sponge. As we age, most of us dry out and our discs dry out. It's one reason why as people age, they shrink. Actually, their disc heights shrink. And since you got 24 vertebrae and a couple dozen discs, by the time every disc loses some water and gets narrower in height, you can actually lose an inch or an inch and a half in height or more as you age, simply because the fluid content in your disc diminishes. But it is juicy discs that herniate and dry discs that typically don't. So Grandpa can go and do the same thing, and his discs are so dry he doesn't blow out a disc. But a young person in their 20s and 30s is much more likely to herniate a disc because they got these big, juicy, fat, wet discs that once you apply too much pressure to them, they'll blow out. You can also hurt them in car accidents. You can hurt them in freak accidents, compression accidents to the spine, diving into something and landing on your head. I mean, there's other ways to herniate a disc than simply lifting incorrectly. However, I would say this. Learn how to lift properly and never, ever do it wrong. I've really, not in my life, met anyone who was decorated or celebrated for lifting incorrectly, but I have met dozens of people in my career whose lives were wrecked by an instant of lifting incorrectly. So I would never do it. Get close to the load, make sure it's what you can manage, get help if you need help, don't lift it if you shouldn't, and don't go wearing your discs out, lifting a bunch of junk and eventually blow one out. It is not worth it. This is the worst spinal injury you will ever encounter frequently, and it is never worth getting one. It is always worth preventing one. And proper use of the spine, as we'll discuss, and proper nutrition and proper exercise and all of that can help you, and we'll try to make sure we cover all of those things before we're done this evening. Now, how do you end up fixing disc injuries? Because as soon as someone has a ruptured disc, the surgeons begin to rub their palms together and get very, very excited. A herniated disc is a surgeon's wet dream because he knows that's an operable condition, and he knows that most of his colleagues will agree that that person should go to surgery. Now, you do find more and more doctors who are more conservative these days than they were when I started practice. And even when I started practice, they knew the statistics were abysmal, and they haven't gotten better. The average person who goes through disc surgery, more than 50% of them will be in as much pain 3 years after the surgery as they were before the surgery. So the statistics on coming out with a good outcome on disc surgery are not great. I do meet some people who have had successful disc surgeries, but you meet a great majority of them who do not. And it's a rough crapshoot to go into that knowing you're going to go through that much pain, that much trouble, that much expense, and come out the other side as bad or worse, which is what happens to most. So the surgical option is, in my opinion, and in fact most good doctors' opinions, including good medical doctors and even good surgeons, will tell you it is the last resort when you haven't been able to fix things. Well, how do you fix them? I've spent time in our clinic, as we tend to do, tracking down the most effective techniques for everything that we do. And that means the most effective techniques for discs. And it turns out there are very specialized techniques for disc, and I want to go through them with you because we have virtually every one of them on the premises here, and only one of them I'll tell you that we refer out to that I don't keep on the premises here, that are the most advanced ways of taking disc herniated individuals in the worst groupings and get them well and out playing golf and living a life and doing what they want to do. And that's where I try to get all of our disc injured patients, and I try to get them there fast. I had one of my disc injured patients come into me as a new patient last week. The last time his disc, and like most people with herniated disc, he's a young guy. He's in his 20s. Last time the thing gave him a fit, it took his last doctor and chiropractor 3 months to get him out of pain. We had this guy flying on an airplane and working in 3 days. It doesn't get faster than that. That's as fast as you can typically get a bad, severely pain-ridden, disc herniated patient to achieve relief. But how do you do that? Because the normal physician can't. I mean, what is a normal doctor going to do? Throw them onto pain-killing drugs, that's one thing. Maybe tell them to do bed rest, that's another thing. But in the end, you still got a problem, which is what are you going to do about this gel that's pushing on the nerve? And you know, when you take drugs, those drugs are not able to release into your bloodstream, and little tiny chiropractors jump out of that capsule and push that gel back. And rest alone, while helpful, doesn't do anything that active to move that gel back. So what you need to do is know how to move the gel back without hurting people. Now, if you listen to the old school about chiropractic and disc injuries, you'll hear orthopedic surgeons say, and they're the guys who like these injuries because that's where their bread and butter is made, orthopedic surgeons, oh, never see a chiropractor. You should never see a chiropractor if you have an injured disc. Why? They'll kill you. And do they believe that? They're not even lying to themselves because they fully believe that. Because if you took some of the old chiropractic techniques where you lay a person on their side and crank them left and crank them right, and they've got a disc injury like this, you will probably only squeeze more gel out and make them hurt. So, partially right. There's a partial truth underlying their fear, but it's not a complete truth because there are techniques that are devised specifically for disc-injured people. And we have most all of them here except for the newest one that requires a specialized piece of equipment that I haven't purchased, a very, very expensive one. Let me go through with you what we do for these patients to get them out of pain. One, we have a technique I gave you a write-up on there called proprioceptive technique. And this technique is non-traumatic. It enables us, the proprioceptive chiropractic technique, to not put a person on their side and twist them. Never do I do that with a disc. In fact, I hardly do that to anybody because it's not my favorite way of doing things, and it does have a risk in it, so we don't even do that. We reposition the bones and get the nerve signals working just using our thumbs. Very quickly, very gently, non-force. It doesn't traumatize a disc person. They don't even feel pain when we do it. And very commonly they go, hey doc, that's better. By the second and third time, hey, that's really getting better. That's funny. I've been going for treatment for months to these other doctors and they couldn't get that happening because this technique that I imported from Vancouver, British Columbia enables us to test where we need to make these gentle adjustments and reposition the bones. Because to the degree you can reposition the bones, you can start to pull the disc back where it belongs. There are other techniques we have here that are specific to disc. There's the world-renowned Dr. James Cox out of Indiana who developed the Cox technique. And he utilizes a table that is not an inexpensive piece of equipment that we keep in our room number 5 here. And the Cox table is devised just for discs. Dr. Cox, who I studied with, has translated every week in his office every paper on disc injury written in every country. It's translated from Japanese, Korean, German. Every paper done scientifically on disc goes into his office and he goes through all of them for the state of the art. And this technique is a table that bends in the middle and enables us to suck disc tissue back into place. You'd say, well, don't they do that in hospitals? Don't they put people in traction and attach weights to their legs and traction them? They used to do that for discs, but none of the smart ones will do that. The problem is if you put a person on traction who has a disc injury and you pull the two vertebrae apart and leave them pulled apart for, 20 minutes, 30 minutes, an hour, you'll create a vacuum that sucks fluid into the disc. And all of a sudden the disc takes on a lot of fluid and becomes very swollen. And as soon as you stand a person up who's been put in traction, they can't even stand. They walked in maybe, even if they were bent like this, and you take them off regular traction, they're like, ah, and they just fall to their floor. They fall to their knees. Because the swelling in that disc became greater when it took on water. So you can't use traction. But the Cox table and the other one we have in room 6 called the Leander table, which is a motorized version of the Cox table, are both developed just for discs. And they apply a very specialized traction that is intermittent at the low back so that we can open the disc and close it, open it and close it, traction it and compress it. And by doing that, we're able to suck disc material back in, decompress the nerves, but we're not giving continuous traction so it doesn't hold fluid and the disc doesn't swell. And if we keep the swelling down while we're sucking the gel back into place, we get a fabulous result. And with these techniques, proprioceptive technique, Cox or Leander technique, we can take a majority of disc injured patients who are wretched. I mean, these are people that are bent over. These are people who can't walk. These are people that are rolled into me on wheelchairs and dollies, and people just figure out how to, they can't even carry, they have to be driven in, they have to be carried in. Some of them are just so bad off they can't function. Some of them are like crawling from the bed to the bathroom just to make it to their own bathroom, and it's a 40-minute job for them to get from the bed to the bathroom when they have one of these disc episodes. These are big, horrendous deals. Beautiful techniques for discs. Now, there is a new invention technique. I was the first American chiropractor to be invited to have it, and I didn't purchase it because it's an ungodly expensive bit of equipment, and it's called the VAX-D. If you're on the internet, you might have read about it. And this is another technique that takes this whole traction, intermittent traction thing and computerizes it and mechanizes it, a $250,000 piece of equipment, and does a very nice job of it. And most people I fix here, this is an expensive piece of equipment and an expensive technique to apply. Costs 4 times as much typically per session to do this as for us to do that. So we don't send everybody out to that, but it is a very nice disc technique that helps a lot of people. But since we've helped most of them in here anyhow, quite quickly and inexpensively, we don't have to resort to that much. Then we use nutrition. As you know, we're very strong on nutrition in this office because our experience and background has proven to us over all the thousands of patients we've treated, you should never underestimate nutrition as a healing approach. It is crucial in anything, and it is crucial also in injuries. If you want to fix disc tissue, it's fairly logical what you're going to want to do. Nutritionally, what you're going to want to do is speed the healing of the fiber tissues. Right? You're going to want to suck the gel back in and re-heal the tissue. Now, when I do my sports and extremity injury seminar, I talk about how doctors are always pessimistic about knee cartilages healing. And medical doctors are pessimistic about discs healing. They're so pessimistic that most of them believe discs don't heal. Now, the truth is, discs do heal. The truth is, they heal slower than any other soft tissue injury, and we know why that is true. If you tear a ligament, whether it's in your knee or your back or your finger, wherever you've got 2 bones joined together and you tear a ligament, we know it takes about a dozen weeks for ligament repair to occur. But we know that a knee cartilage or a spinal disc are different. By the way, a spinal disc is also called cartilage, just like the knee cartilage is called cartilage. And the difference between cartilage and ligament is this. In the adult human, the cartilage of your spine and the cartilage of your knees are the only 2 tissues in the human body. Cartilage is that only tissue in the human body that after age 18 does not have a direct blood supply. Every other tissue in your body has capillaries bringing blood to it so that it can be nourished and take away waste. But for some weird reason, known only to God and God knows who else, your cartilages, after you turn age 18, don't have any blood going to them. And they live like sponges. They live like sponges. They have to absorb nutrients from the surrounding fluid, and they have to extrude or let go of waste into the surrounding fluid by being pumped and moving. This becomes very important when we come into the seminar section later and we talk about degeneration, because spinal degeneration occurs when joints don't move and discs don't get pumped. And of course, once they jam up like this, they don't get pumped either. So they're not healing. They are slow healers. That is the truth. And the reason the medical profession is so pessimistic on their healing are several reasons. One, they like to use drugs, and if you study up on the drugs they like to use, you will find out that those drugs sabotage the healing of soft tissue. So while they're covering up pain and using non-steroidal anti-inflammatory drugs like Motrin and Advil and all that stuff, they may be covering up your pain, but they're slowing the healing of your soft tissue because it interferes with that. So they're sabotaging healing even though they think they're doing a good thing. Another reason is they don't know how to pull the gel back into place because doctors really only have their prescription pad and their scalpel. So they're either going to put you on drugs and bed rest pretty much or send you to surgery. They don't have a lot of middle ground when it comes to disc injury, and as they don't in so many areas. So there's another reason for their professional pessimism is that whole gap in the middle. They don't know how to supply useful services. And finally, because discs are such a slow healing tissue by nature, they have a reason to be pessimistic because they don't want to heal well. And they don't use nutrition, which could speed the healing of fiber tissue, because they don't believe in nutrition because it's a dirty word in medicine. So by the time you add it all up, you can understand their professional pessimism when it comes to disc injuries. But I can tell you we have taken hundreds and hundreds of disc injured people and returned them to quite normal lives. I had one guy actually who was on my staff who had had a disc injury that had been going for years. And this guy was unable to run, he was unable to do sports, he was unable to have sex with his wife. I mean, this was not a good deal. And we brought him through proprioceptive technique, and now we've got him in our strengthening department where we're doing the rehabilitative exercise. He's running, he's got a normal sex life, he's living a very normal life. Rides a motorcycle. I mean, this is stuff you don't expect of a guy who's crippled with a herniated disc. And we've done that time and time again with patients. We can do it with the majority of them. There is a failure rate with discs with conservative treatment, and some of them will not get better because you can't get the gel back, or if they're in this category of a free-floating fragment, you got a real problem. They are probably going to end up to be a surgical case because there's no way to suck that back in. It's not attached. So no matter what you do to move this isn't going anywhere. So that becomes the kind of patient that we unfortunately expect to move on to surgery. Even so, we do not send many of our patients to surgery. I have less than one of my patients a year go to any kind of surgery, just to let you know how few that really turns out to be of all the patients we take care of. Now, in terms of nutrition, we'll use things like Ligaplex and Mintran and Calamo to restore a disc, collagenix, things that repair the collagen fibers, that repair the healing of this whole tissue group. And that becomes very important in healing discs. And we have nutrition programs that can reduce the inflammation and the pain and get the area to heal, where we can use natural anti-inflammatory substances that, instead of the drug inflammatory, speed healing where the drug's slow healing. So you get the effect of reducing pain and inflammation while speeding healing. Much better to do that nutritionally. We can use products like Inflavinoid that come in the silver bottle, a natural anti-inflammatory. We can use enzymes like Biozyme that have natural shrinking and anti-inflammatory properties, especially in acute disc injuries and acute pain. With disc, we've talked about some techniques. Let's talk about the other things that are important. There's another new breakthrough that can be very important for disc injured patients, and it's the new nerve block technology. And this is a recently developed electronic technology. Again, we have it in our office, where you can do electronic blocking of nerves. It's not TENS, it's different than that. It enables us to completely electronically block a nerve on a temporary basis, which helps disc injured patients, certain of them, to just get some relief so they can heal. Because these people get frayed. They've got nonstop 24-hour-a-day pain. Give them a few weeks of that and they are frayed out. So just being able to bring them relief. If these other things are not doing it fast, we can use the nerve block technology and just put the electrodes on, dial in the frequencies, and we can cause the nerves to attract so much calcium that the signals just stop. And it's non-painful, non-traumatic, non-everything. It's a very, very cool new type of technology called calcium blockade, nerve blockade, and we have it in our office, and it takes very specific new kinds of instruments that were just recently developed. They're very cool. Also, the braces can be of help for the person who has a disc injury, and they can be of some help, the low back braces, in preventing injury, so that if you're in a lifting profession and you wear one of those things like you see at some of these warehouse stores and so forth, they're wearing back braces, those can be helpful. Even more helpful have been programs where they introduce stretching to people who are in lifting careers, and where they just put in like 15 minutes of stretch time in the morning before they begin their workday. They can reduce the number of back injuries and disc injuries dramatically if they do some stretch. We'll talk about stretch a little later tonight. The one thing I would tell you about discs, and the reason I put it into this section, is that discs are crucial to spinal health. You don't want to degenerate them, we'll talk about that later, but you certainly don't want to herniate them or rupture them, and that's why I put this section in this workshop. You always want to lift properly. You do not want to subject your spine to stresses where you're going to herniate a disc. You never want to go there. If you know someone that got there, you'd be smart to send them to a place like ours where we have a range of techniques where we can fix them non-surgically and get the vast majority of them doing well. Because if they just go out to surgery, the majority of them will not do well. The American College of Physicians and Surgeons, which is the surgeon's own group, estimates that 90% of all, I'm sorry, that's 98% of all the back surgeries performed in America were unnecessary. So there's a huge overutilization of back surgery. The federal government did a big study last year and concluded that almost everything that was done medically for people with low back pain was negative on an effectiveness scale, and the only things that they could find that had positive effect were spinal manipulation, which is typically never done by medical doctors but done only by chiropractors, and back school, which taught people how to take care of themselves, which is what we're doing tonight. So those are the only things in a very extensive federal study they found that had lasting and repeatable use for people with low back pain. It is a fact that if you're going to herniate discs in the back, the two most common will be the bottom two, this one and that. You can herniate any disc. The neck can be herniated in a bad car accident, for instance, and sometimes people will herniate some in the middle, but that's not too very common because the low back is the one where you tend to get the big compression stress, and the lower neck is the one where you can get the whiplash stress. And those are the two areas, and the low back by far and away the first most common where you find herniated discs. The other ones aren't so common at all. So that was a bit of a long subject. Let's start going through some shorter but also important ones. Women like to look good and wear high-heeled shoes. And men like to look at women who wear high-heeled shoes, but the problem with high-heeled shoes is they are not good for your back. And when a person is in high-heeled shoes, what happens is it changes all their back curves. We're going to talk tonight a lot about these curves of the spine, because when you view your spine from the side, you should see three curves: a C curve in the neck, a C curve in the middle that goes the opposite way, a C curve in the low back that goes the direction of the neck. So you got 1, 2, 3 curves in the spine. That's normal and healthy. If you lose any of those curves or exaggerate any of those curves too much, you run into problems. They are supposed to be exact amounts of curve in each of those three areas to have a healthy spine. When a woman wears high-heeled shoes, or I guess here in Hollywood or West Hollywood, a man wears high-heeled shoes, you end up with changing the whole angle of the back, and it pushes their bottom up. And that may be cute, but it changes the angle, changes all the curves of the low back, and weakens the low back. There have been numerous studies that show that if you take women with low back pain and get them to wear either flat shoes or up to about 1.5 inches heel. You can get up to about 1.5 inches heel and not run into problems typically. When you start going into high heels, you run into problems. And if you have low back pain or a history of low back pain, you're very smart to not wear heels. Let's not give the men too much of a break here. We need to rag on them a little bit. Another very interesting study was performed on thousands of men and found out that you do not want to wear your wallet in your hip pocket. If you sit on your wallet in your hip pocket throughout the day, you create an imbalance in the back. And the study was found if people move their wallet out of their hip pocket and put it somewhere else, a number of men, a very large percentage of them, feel better in terms of back pain. So do not wear a wallet in your hip pocket. It was actually an orthopedic surgeon study, and I guess, you know, surgically removing people's wallets wasn't that far from what they were doing anyhow. But but the truth is, if you don't wear your wallet in your hip pocket, you're going to be better off. For years, I've just carried a money clip in my front pocket, or if you want to, you could put your wallet in your front pocket. You're going to be much better off just carrying the few pieces of ID and credit cards and cash that you need in a front pocket than in your back. If you'll notice, when we correct people with low back problems, we'll take those wedges, I guess I don't have a pair here, but wedges, and we'll slide them under the pelvis, and they're only moving the spine a little bit, and we can correct low back with those wedges or blocks. But a person who's sitting on a wallet all day that's 3/8 of an inch thick or 1/2 an inch thick and pushing one buttock cheek up and the other one down is creating an imbalance in the spine that isn't good for you. So that's a good tip for men. Now, when we deal with these spinal curves and keeping them in place, they're important to keep in place when you sit, they're important to keep in place when you sleep, they're important to keep in place when you work. So let's go over some of these things. We'll talk a bit about sleep. People spend more time, it's said, in any given single position in bed than they do doing any other thing. And as a result, how you sleep can have a big effect on your spinal health. And it seems to me, from my experience with patients, that people develop habits and then just get into them. And they may be habits they developed when they were babies. And some people, oh, I always sleep on my stomach most of the time. Oh, I tend to sleep on my right side. Oh, I sleep on my back. Which of those is any good and which of them might be bad? Well, here's the way it plays out. Don't sleep on your stomach. Here's what happens when you sleep on your stomach. You're probably going to want to breathe. And because of that honest enough impulse, you will find yourself turning your head. And if you sleep with your head turned all night and your neck kinked all night, you're going to end up with spinal problems. People who are stomach sleepers end up with degenerated spines. It's very important to break that habit. Now, it is true from all the studies I've read that the average person will change position in sleeping at least 5 times during the course of a night. So a person does not sleep just in one position all night. We move around, and for good reason. However, you do want to spend most of your time on your back and some of your time on your side and virtually none of the time on your stomach. The reason you can sleep on your back is you can preserve your spinal cords if you have a good mattress and you're doing the right things with your pillows. So let's talk about those. A mattress in general has to fit certain criteria to be healthy. It should be firm enough that it supports you, but springy and resilient enough that it fills up the spinal curves and supports them. If it's too hard and too flat, it's not supporting the spinal curves, it'll flatten you out at night. So you pick a mattress that is resilient enough that if you lie on your back with your spinal curve there, you can't slide your hand in here. If you can slide your hand in here, your mattress is too hard. If your butt sinks into the mattress, it's too soft or too old. So you got to pick a mattress that doesn't let your butt slump in and that isn't so hard that it doesn't fill the spinal curves. Either way, it's too hard or too soft. Got to come to that middle ground where it gives you the right kind of support. One thing that you want to do is make sure you support the neck curve properly. It's very easy when you're back sleeping to screw that up. Sometimes a woman wants to sleep with 4 pillows under her neck, makes her feel like a princess. Well, it'll make her look like an old hag because what happens is all those pillows under your neck that's forcing your spinal curve, which is supposed to be a C curve like this, into that is going to end up giving you a reverse spinal curve. And that is going to play out to be a nightmare. You're going to end up with a degenerated neck, degenerated discs. So what do you need when you sleep on your back? You need a small pillow that supports your neck curve. And basically, amongst the most commonly available types would be either a specialized cervical pillow. We carry several types of those here for people to have. Or you can use a nice goose down feather pillow that isn't overfull and just let the feathers fill underneath your neck and not put too much under your head. If you put too much under your head, it jacks your head forward and you're going to end up with a bad neck curve problem. It's nice to have a pillow that enables you to sleep in both positions that are acceptable, which are back sleeping and side sleeping. And that's where a pillow like one type we have here that has one edge for lying on your back, and you turn it 90 degrees and you can lie on your side, and it supports, because when you lie on your side you got to fill this gap between shoulder and ear. If you don't fill that, or if you overfill it, then you got your neck flexed one way or another throughout that period of sleep, and that's going to screw up your neck. Generally you want to keep your spine straight when you view it from the back and properly curved when you view it from the side, and that's true in sleep as well, and that's why back sleeping is preferred, and when you shift onto your side you need to have your pillow fill this, which you can do again with a down pillow by just smushing it in differently and put it underneath your head, and you can fill that space. Or if you get a pillow like that one that has two edges, lie on your back on one side, turn on your side, and flip it the other way. These are the best ways to sleep in terms of pillows. The most common spinal architecture problem we run into is a person whose neck curve is either straightened out or reversed. And how often do we see this? Every day. How many patients? Way more than half. How many of the ones that complain of neck or shoulder pain? Most have curves in their neck that have been damaged and lost. When they were little, they probably had a perfect neck curve, and somewhere along the line, sports injury, whiplash injury, sitting at a computer, however they got there, they ended up with a curve like this. And the effects become devastating over time. And you want to be able to restore a normal C curve to a person's neck, because when it goes straight or reversed, instead of having the nice C curve it should have, their discs degenerate, calcium spurs form, nerves become pinched, and the whole thing over a period of years becomes a nightmare. There is a breakthrough methodology for that that was just made available last year, and it's this new invention called a posture pump. And what this is a device that enables us to have a patient lie upon it who has a lousy neck curve, strap their head in, pump up this little air bladder here, and because of the way the thing works, it actually reforms a neck curve much more strongly than any other method we've ever had over the years. And I've been studying how to restore neck curves all my career. This is a breakthrough. It works best when a person is receiving chiropractic adjustments that then open up the joints and discs of the neck so they are flexible. Because people who have reverse neck curves and straighten out neck curves, their necks are not moving right. And when they have degeneration going on, those joints are not moving at all. So when you take a posture pump and just put it into a neck that isn't moving, you aren't going to get the result. But when you have chiropractic moving those joints again, so those old crudted up joints that are sort of like a jar whose lid got stuck on and you got to get it to twist and move, and we use chiropractic with our hands to get those joints moving again, then we can put a person on a posture pump and have them use that day in and day out for a number of months and reform a C curve back into the neck, arrest their degeneration, heal up their discs, get their spine working right again, shoot a new x-ray, see a nice beautiful C curve on their neck, and know we've done a beautiful job and we've changed the whole course of where their life is heading. Because when you end up with a degenerating neck, it's a nightmare. Those nerves that degenerate, by and large, are always at the C5 and 6 level, which means it's part of the arm, shoulder, hand switchboard and forward to the neck and thyroid gland. And you start shutting down those nerves more and more, and you start to know why so many people at night, oh, my arms are going numb. So many people as they get old, I can't really write anymore. My hands are too tired. I can't hold even a coffee cup anymore. My grip is too weak. What is that all about? Most of the time it's all about a degenerating neck. And one side view x-ray of that person's neck will tell you everything about what's been going wrong with them. And the problem is by the time we x-ray some of these people, what's been going wrong with them has been going wrong for 25 years. And they never knew enough to know what to have done about it, how to have fixed it, how to have arrested the whole thing. And just like really bad tooth decay, now they got a decaying spine. But what are you going to do? Drill it out? You can't do it. Shoot them up a little Novocaine and get a drill and do it like a dentist? Can't do it. All that crud that's in there they have to live with, and the thing we have to do then is jack the pressure off those nerves, adjust them properly, use some nutrition, and try to get them to live out, maybe they're going to live another 20 years, live out another useful 20 years where they can use their hands instead of something where they're getting weaker and weaker and weaker and getting worse and worse. Ergonomics. Why do I feel like I left something out about sleep? I did. Mattresses. Let's just go back to one other thing on mattresses I knew I wanted to tell you. Some people know this and some of you don't. When you buy a new mattress, you got to rotate it. And you got to rotate it throughout its entire life. Here's the way it goes. When you buy a new mattress, once a week for the first month or two, flip it lengthwise and widthwise. Here's the reason. Mattresses are made up with springs and stuff in them, and if you're lying in the same spot every night as most of us do, your butt will make an impression in those springs, and pretty soon there's a permanent hole where your butt is. So you buy a new mattress, you flip it lengthwise and widthwise. Now the place where you sleep and the place where your spouse sleeps have flipped completely. They're on totally different positions. Both butts are not where they were last time. They're not even on the same side. For the rest of the life of that mattress after the first month or two, flip it once a month, lengthwise and widthwise. When you do that from a good mattress, you can get a reasonable life. 10 years, something like that. 7 years, 10 years, 11 years out of a mattress. They don't last forever, and you're going to end up buying a new one. But let me tell you, if you don't rotate them, they don't even last at all. And you can kill a mattress in a year. So you go and make an investment in a mattress and don't rotate it, and you've got junk that's giving you spinal pain because you didn't rotate it. You got to buy a new one because you wrecked the springs. So you got to know to rotate those things. Okay, now let's go to this subject called ergonomics. This is a fairly new word, and it basically means the study of work. Ergo is a word that means work. The study of work, and it's a fairly new idea, you know, as consciousness has evolved a little bit to realize that if you took care of people in the workplace better, you wouldn't have so many injuries to pay for at the back end, so you could focus on prevention. And it's a new field, relatively new. In fact, a lot of companies and businesses are barely aware of ergonomics still. It's such a newish idea. But it's an important idea, and I think every individual needs to be sensitive to their own ergonomics. Don't wait for your boss or someone else to fly in from the federal government and care about your ergonomics, because that may be way too late. You need to care about your own work environment and figure out, are you doing things that in the long run are going to help you or harm you in terms of the way you work? And some of those things are very important when it comes to the spine. We got more and more people, of course, involved in computer careers. And so computer ergonomics becomes a fairly important subject. Like if you got your computer set up all wrong and you're twisted in an angle, or you're looking down at your monitor, or you're looking way up at your monitor, you got problems, because you basically want your neck facing straight ahead so you can keep a decent curve in your neck, assuming you've got one to begin with. You don't want to be bent over like this. You got people, for instance, that are in drafting or drawing careers or detailed careers where they're leaning over books all day like this, or leaning over stuff all day like this, and they're craned over their work. Most of these people end up with necks like this. And you know what happens when you start with a neck like this, and we shoot an x-ray and your ear is way ahead of your shoulder instead of being on top of your shoulder the way it should be? Is as those people age, they get more and more like this. They got their heads ahead of their gravity line, and as time goes on, you've seen people like that, and they just get more and more like this. It's not only not pretty, even beyond aesthetics, this is not functional. These people are not feeling good because the body is wasting a tremendous amount of energy to try to support itself like this instead of supporting itself straight on the axis of your spine. Your ear is supposed to be over your shoulder over your hip over your knee over your ankle, and that is good posture. You know, you got some people where they think it's so cool to be like this too, you know. And this isn't cool. You know, you got to get some of these kids to realize, let's get posture straightened out here because this does not play out well. And then you got people in the workplace who end up screwed up. I take care of a lot of musicians, and some of them have straps of guitars and saxophones strung around their neck, and they get all this weight on their shoulders, and it messes with them. Some of them are violinists. Probably the most unnatural thing you could imagine is to have an instrument, you know, under your chin like this. These people have nightmare necks. And some of them work sales jobs and jobs where they have telephones. And instead of having a headset, which is if you are on the phone a lot, get a headset, these people will take a phone and hold it to their ear like this for hours a day. There's a principle in the human body that most of us know innately and intuitively, and we've learned, which is if you use muscles, they get stronger. Most of us know that. You work muscles, they get bigger, they get stronger. And if you don't use muscles at all, they get weak and atrophy. Most of us know that too. If you ever broke a bone and they put you in a cast, and even in 6 weeks those muscles started to get weak. These astronauts go up in space for a little while, and that guy's having a rough time who just came down to Earth because he didn't have to use the muscles where there wasn't gravity. Now he finds himself in gravity, he's too weak, just from some weeks of not using muscles. What most of us don't know that is a fact about the human body is that our bodies have a built-in wiring diagram that works like this. Every time you fire a muscle, the opposing muscle is turned off automatically electronically. So every time you work your biceps, your body turns off your triceps. And every time you fire your triceps, your body shuts off your biceps. The action of firing one muscle automatically, electronically turns off the opposing muscle so that when you move, you don't find yourself trying to do this, which is what you would do if you didn't shut that one off. And every time you straighten out, you don't find yourself doing this, which is what would happen if that one didn't turn off when you decided to straighten your arm. That system of what's called reciprocal inhibition exists in all muscle groups in the human body as a built-in program. It is an electronic program of the body. Now, if you go and fire a set of muscles on one side of your neck by holding a phone like this, what are you doing to the other side? It's reciprocally turned off. And what happens to a set that you're constantly firing and using while the other set is constantly being inhibited and not used? This one gets big, that one gets small. And what do we see on the x-rays of these people? We see their necks all twisted to one side. Why? Because all of these attachment points on the bones here, all these stick-out parts on the bones that make them look like they got little noses and ears, wasn't God having a funny sense of humor particularly. These are attachment points for muscles so that your body has leverage to move these bones around. But when those muscles are pulling on one side and inhibited on the other, you get into these weird torques in the neck, and then there are compressed nerves and then degenerating discs, and a person ends up with spinal decay. Why? Because they didn't realize. Buy the headset. Hold your head straight. One of the key points you want to do as much as possible in your work is use your body in a symmetrical and balanced way. Don't try to do everything on one side and not on the other, because that's the same deal again. If you build one side and inhibit the other, you're going to twist things in one way, you're going to pull on one set of muscles and not on the other, and the whole thing that keeps you with a straight, balanced, linear, properly curved spine includes muscles that are pulling equally to the right, pulling equally to the left, pulling equally down on the right, down on the left, so that these vertebrae are kept aligned. And if you've overbuilt one side and underbuilt the other by turning it off, you're going to run into problems. So think through your own career and say, is there something like this that I'm doing all day? And if so, how could I balance that so that I could use the other side? Or I could eliminate this imbalance that I've generated or this postural error that I've generated. And that's the sensible application of ergonomics. We do invite any of you that are patients, if you want to shoot some snapshots of yourself at your job and bring them in here and have us do an ergonomic evaluation for you. We're happy to do that for any of you and tell you what recommendations we would make in terms of your work. The next subject I want to cover with you is this subject of degeneration. What you don't want to have happen to you is have your joints degenerate. I've become more sensitive to this. I guess most of us find we get a little older as we age, and we start to realize, hey, life's still going on. We didn't think we were going to make it to 40, and suddenly we're there, and it keeps going on. And more of us are going to live to be 80 and 90 and 100 years of age than ever before. And that means that people who start having degenerative problems in their spines when they're 20 and 30 and 40 have a very particular nightmare to face unless they get a real grip on what's going on, which is if they're going to live 20, 30, 40, 50 more years, how degenerated are they going to become? Well, let me tell you, when you talk about degenerative arthritis, it can become a nightmare. This picture I took on a guy the other day, I couldn't even believe the picture. I was in such shock. He came in, he's 49 years old. He comes in on a cane. He's walking like this with his cane. Happy looking normal guy, walking like this on his cane. And he says, something's wrong with my hip. It's finally gotten to the point I can't even walk. And I gave him a health pass like I'm giving to you guys tonight, and I said, I'll shoot one free picture for you. Let's see what's going on. And I shot this picture. Many of you haven't seen hips before, but let me tell you, they're not supposed to look like this. There is no cartilage. There is no space. The head of his hip is completely deformed. There's calcium everywhere here. There's no joint. This guy is 49 years old. He has no hip. There is no hip. It's already over. It's fully degenerated. Well, what happened to this guy? Well, he'd been practicing martial arts since he was like a young guy. Started in his teen years. He was kicking and sparring and everything was great. He's a healthy, strong martial artist. Except nobody ever told him what I'm going to tell you, and he never had a clue of this simple fact. If you move a joint a little bit out of place and you let that joint heal a little bit out of place, it starts the process of slowly degenerating that day. And year after year it deposits more and more calcium until you get to a joint where you can't even see there is a joint. He doesn't have a joint. This guy will be in hip replacement. He's not even 50 years old, and no one's going to fix that. It is unfixable because there's no joint left. Now that's pretty bleak and pretty bold and pretty ugly, but the truth is we see versions of that in patients every day here that come in to see me. Here's a person. Let's see. This person's in their late 30s. These spurs and narrowing discs here are degenerating discs. He doesn't have herniated discs like we talked about earlier. These are vertebrae that misalign. There's no C-curve in his neck. His curve is going slightly backwards like I've been talking about in this last section we were on. And these joints have not been moving. And cartilages don't get a direct blood supply, right? Discs don't get a direct blood supply. How do they live? Like sponges. They have to take fluid, nutrients from their environment and give waste away to their environment by moving. But what happens when this area hasn't moved in 10 years, which it hasn't? It's completely degenerating. The guy's only 30. Imagine what's going to happen when he's in his 40s. Imagine in his 50s. It's going to look like this hip. And what's he going to do then when his spine is degenerated like that? He's going to either live with a lot of pain or, I mean, what's his doctor going to do? Tell him to take drugs? That's what they do. Here's another one. There's no disc left. How old's this one? Oh, this is an old person. This patient's 80 years old, but we see spines that look like this and they're 50. Because her problem may have only started 30 years ago. But what happens if your problem started in a whiplash injury that happened when you were 16? And nobody knew to send you to the right chiropractor, restore the curves, heal the discs, use the right nutrients, do any of the right things, and the spine starts degenerating. Here's one with huge spurs in the low back, disc nearly gone. Age, this one's 64. But think about being 64 and having a degenerated spine like that. You're going to live to be 74. How about 84? How about 94? You're going to add 20, 30 years to that much degeneration? Where's that person going to be? They're going to be crippled is where they're going to be. The one good thing to do about degeneration, see, medically degeneration is viewed as an act of God. Like so many things, 50% of the diseases in all medical texts are listed as cause unknown. They think 50% of the diseases on planet Earth are just cause unknown, because the cause is not the strong point of medicine. It's their real weak point. What causes anything? Oh, we don't know. Here's our prescription pad. That's how medicine goes down. But there is a cause of degenerative spinal conditions. And the cause is small misalignments, small ligament tears, pinched nerves, things that aren't working right and then got left that way. People come into me and say, I got people coming in here, they're 25 years old. My back's been hurting me on and off for the last 7 years. And they think it's normal. Let me tell you, that isn't normal. You got people, my neck's been killing me on and off for the last 5 years. They think that's normal. That's not normal. That's degeneration. That's a person that's only in their 20s and has a degenerating spine. Why? They had this whiplash, they did this thing cheerleading, they played football, they played basketball, they were boxing, they fell on their head, they banged into this, they did that, and they messed up their spine, and no one told them that those tiny little misalignments of the spine result in this. And that's exactly what they result in. So can you prevent degeneration? Yeah, absolutely. I've been practicing preventative care with my spine since I learned about it in my 20s. I'm 47 now, and I use my x-rays every day as textbook normals here. I show them as the textbook normals for normal curves, normal discs, and lack of degeneration. And yet I come from a family that has completely degenerated backs. But you want to know something? Degeneration is not congenital. This is not a hereditary thing. Doctors, not knowing the cause of degeneration, guess about it. Oh, is it hereditary? Is it this? They call it wear and tear. They don't really know. Some of them, the real specialists and researchers, know that it comes from damage. But the majority of them don't even know that it was unhandled, unfixed damage that results in degeneration. How do you prevent, how do you arrest, how do you prevent degeneration? Here is the key. All the drugs in the world do nothing. Nothing. It doesn't matter how much pain cover-up and things you do. That does not stop degeneration. What does? You've got to realign the spine to get it functioning right. You've got to get mobility back in the joint so that every vertebra moves against its neighbor. Because what happens if one vertebra doesn't move against its neighbor? Somebody's in between. Who? The disc. And the disc only lives by motion. You take motion x-rays, and those exist, by the way. Motion picture x-rays have existed for a long time. And we have taken motion picture x-rays of people with a misaligned neck where there's some calcium spurs. They may not even be big ones yet. And you know what we find? You can put the person through the most exercise and stretch in the world. You know how much the discs and joints move that are damaged on a motion x-ray? 0. They don't move at all. Everything else is moving. They're not moving. Well, when you think about it, that's only sensible, because that's the joint that's degenerating. If it were moving, it wouldn't be degenerating. Life loves motion. Life hates no motion. That is a very key and important fact. Life loves to have motion. It hates no motion. No motion is death. And when there's no motion occurring at a joint, it's dying. Now, we're very self-reliant folks, and in California you have to exercise. It's a law. But even so, you think exercise alone is going to fix one of these degenerating joints. It doesn't. It will play a role after you've done some chiropractic and got it moving in helping maintain it, but even it alone will not maintain it, because the joints that stopped moving are the ones that when you exercise do not move. And that's why chiropractic is a very specific tool for this. You'll find that when chiropractic is done, if you pay attention, you'll notice we're putting a hand on one vertebra and moving the neighbor. It's just like if you had a jar with a stuck lid, you can't just grab the lid and twist because the jar just turns around. You got to grab it and grab the top and then twist. And when we do chiropractic, there's always one hand that's the stabilizing hand and one hand that's the adjusting hand. And whenever it's done right, that's the only way you get a joint that's locked to move. That's the key to chiropractic. You want to know why I use my spine as textbook normals? Since age 20, I have always been under maintenance care. That means I get adjusted once a month, not because I'm in pain, not because I have a problem. Maintenance care is the thing you do because you're feeling fine. Maintenance care is maintaining a good scene where you don't feel you have symptoms. And when a patient comes to me that has degeneration, and maybe they're 35 years old, maybe they're 46 years old, maybe they're 65 years old, I have to tell them the same advice. And this is what I always tell them. Maintenance care for you, Mr. or Miss Patient, isn't a luxury. When we are done with corrective care, maintenance care for you is an essential. Because here's what's going to happen. Maybe we do X number of weeks of corrective chiropractic and we get everything moving as nicely as it can move, and they feel like $1,000,000. They go, God, every problem I came in here with is gone. I feel awesome. You've done a great job. If at that point we stop doing everything altogether and wait until their next problem occurs, whenever that might be, let's wait 5 years. You know what? My back's hurting me, Doc. Why don't you fix me now? We haven't done anything for 5 years. What happened? The joints that showed up in degenerative condition when we started with them at the beginning have not been moving over those 5 years, and they still didn't have any symptoms. See, we like to think that symptoms and pain is the end-all and be-all of understanding what's going on in the human body. It isn't. Symptoms and pain are pretty much like the idiot lights on a General Motors car. And by the time the light goes off that says alternator, you throw the alternator away. It's gone. That's it. And by the time people come in here and say, Doc, my neck's been bothering me for the last 3 weeks, but I really haven't had a problem, and we shoot an x-ray and see 20 years of degeneration there, not a day less. The question is, did they have their problem for 3 weeks? No. The x-ray tells us for sure. They had the problem for 20 years. They were relying on symptoms to tell them stuff it couldn't tell them. What I like to do with my own spine, and I recommend for you guys, is I take an x-ray of it every 7 years. I look at it and I see, how does it look top to bottom? You don't want to over x-ray, but then with our new x-ray machines, they're so low dosage anymore compared to what we used to use that I think that's totally prudent. You can shoot a whole full spine x-ray and get less radiation than getting on an airplane and flying to Chicago and back. So unless you don't fly and you don't do anything, you're not talking about huge amounts of radiation. But what do you learn? You learn a lot by shooting that x-ray and finding out what is really going on. What do I need to know? Do I have a C-curve in my neck? Do I need a posture pump? Do I have a degenerating vertebra in the middle of my back I better get adjusted and maintain, or don't I? Have I got a degenerating lumbar disc down in the bottom of my back that's going to end up blowing out my legs and keeping me from walking and putting me in pain all through my days and pinching nerves to my prostate or my uterus and giving me prostate cancer or some kind of female disorder, which is where these low back nerves go? How do you find that out? You find it out by shooting the picture. That's how you find it out. It's inexpensive, it's accurate, it's black and white, and it tells you so much stuff. There was no way I could have looked at that guy on his cane and known what his hip was doing without shooting that picture. And when I looked at it, it was like, oh my. And he had such a wonderful story to tell about how he hated doctors and didn't believe in chiropractors and never did anything all his life. And he gets to go directly to hip surgery. Actually, he never even followed through on my recommendations to even diagnose him properly, because I told that guy, with that much degeneration, we better shoot some pictures of your spine and figure out what's going on. But he has his head so firmly buried in the sand to get to even that place in his hip that he's still so firmly buried in the sand, he's not going to figure out what else is going on. And probably he's going to end up with a completely degenerated spine next. And what are they going to do then? They don't do spine replacements. They'll throw some kind of plastic hip in there for better or for worse. And it may or may not work. We talk about that in another seminar, that kind of surgery. Chiropractic is, when employed properly, when advanced techniques are used, when you can do things as accurately as we do them in our office and as thoroughly in covering every joint in the comprehensive way we can in our office, it is the definitive technology for preventing spinal degeneration if you don't have it, arresting spinal degeneration if you already do, and keeping it at bay so you can live out your normal life expectancy happily rather than crippledly. That's, that's pretty much what it comes down to. Nutrition plays a key role in healing the spine and in preserving it. We recommend in all of our chiropractic maintenance nutrition programs that people, for anyone's nutritional maintenance program, take some bone support. You want to make sure your bones stay strong and properly nourished. A product like Calapatite I put into every long-term nutrient program. If I haven't put it in yours, you better ask me to, because you've been to the seminar and you know you want to keep your bones strong. You also want to keep your joints strong, which means all of your ligaments have to be in good shape. All your cartilages have to be in good shape. So you want all the raw materials of ligaments and cartilages in your diet. Are you getting them all by the way you're eating? Probably not. Why? Most of us just aren't that careful. We just aren't that good. We like to eat what we like. You know, we don't always like to eat what we should. So you bring in things like Ligaplex and Mintran. You got some calcium, magnesium, trace minerals. You got your manganese. You got your building blocks for ligaments in there. And what do you have? Everything in place so that the minerals and subproducts that build your bones and the things that hold them together and the pads that space them apart are all present. Because I'll get patients who come in here. I'll never forget Dr. Cooper, who started as my patient years ago and then went to chiropractic school and now works with me, brought one of her relatives to me years ago. And this guy came to me and he had like 6 herniated discs. And he was an orchestra conductor. I said, how do you get to 6 herniated discs? You know, where? Anytime someone comes to me and they got 3 herniated discs, they got more than 1 herniated disc, I want to know the story. Because unless they were in massive trauma, which some of them were, massive trauma could create that many disc herniations. But when you come up with people who have got 4 and 5 and 3 and 6 herniated discs, and they don't have massive trauma, they've lived normal lives, nothing particularly trick about it, you know something right off the bat that their medical doctors will never guess, which is they're malnourished. These people have soft tissue systems that were falling apart. And that's how that many disc fibers frayed and broke through and that much gel got squeezed out of the tube, is that it wasn't that they were put through that much force, they didn't have any tissue integrity. And tissue integrity is the ability to take in the nutrients that you are supposed to ingest and assimilate them and get them to where they're going in the body. So you got to be able to have the right stuff coming in and a digestive tract that can assimilate them. Well, that's the reason we put these kind of nutrients in, and also in our chiropractic system we evaluate people's digestive systems and make sure that they're working. I got a kid now that they're driving down to Santa Barbara, from Santa Barbara to see me, who has this horrible Crohn's disease, the top of the line type of colitis, of colon illness. And I have a long track record on curing these patients, and they're bringing them to me and we'll have them cured in no time, no doubt. And he comes down here and they notice he's not growing. They run his blood work and they notice there's no iron in his blood and his bones aren't growing. Now the average doctor just goes, huh, they can't even think with that. There are clues staring him in the face, but the pattern isn't making sense to them. But when you understand human digestion, it all makes sense. Because if you don't have stomach acid, you're not going to bring iron into the body, and you're not going to bring calcium into the body, because all the hard minerals are only brought in by acid. And I test his stomach, and it's not working. And they're, of course, in medicine, what are they going to do? Put him on drugs. If your colon doesn't work, here's some prednisone, here's some azolfidine. They put them on these strong drugs and poison them. Of course, they don't really get well. Why? Because they don't have a drug deficiency. That's not their problem. None of those people's cause of their colon problem was a drug deficiency. Oh, you just don't have enough drugs in your body. We'll have to supply the right amount and we'll get you right. That's not the problem. They do have real problems, and he has a real stomach problem. I'm only bringing that up because you can give the person the right nutrients, but they better have a stomach and a digestive tract and a small intestine and so forth that works. For those of you that were here last week, that was the subject we covered last week, was how to understand, correct the entire digestive tract. It's in a seminar called Superior Nutrition, and as you know, we're videoing this one tonight. All of them are out on video now, so any of the ones you want to catch up on, you can take home and watch. Finally, let's talk a bit about exercise. Exercise does play a role in spinal health, in maintaining a perfect spine if you have one, in restoring a bad one to good if you got a bad one, in maintaining one once you've fixed it as good once you've fixed it. So let's talk about that. One, it pays to do some weight training. Weight training, in addition to strengthening muscles, which is great for the body, also strengthens bones, because we know for a fact by one of the laws of the human body that the more weight you put on bones, the stronger they become, as long as there's minerals present to build them. Your body will build them stronger if they're carrying weight. So weight training does help strengthen the skeleton. It does help strengthen the muscles. And when your bones are strong and your muscles are strong, you do have a couple very important ingredients for spinal health. Stretch can be super important. And stretch isn't too hard to figure out when it comes to the spine, because you have got only certain ranges of motion with the spine. You got back extension, you got forward flexion, you got side flexion, and you've got rotation. And those are the standard movements that a spine is designed to go through. Yoga figured this out centuries ago, and it hasn't been improved on a whole lot, which is if you systematically forward bend, side bend, back bend, and rotate, and go through those ranges of motion on a regular basis, you maintain more flexibility. There are books on it, there are movies out on it, there are videos out on it, we can give you handouts on it. We can train you in our rehabilitative exercise gym on it. There's all kinds of ways to go about it, but the simplicity is this: if you keep some stretch and flexibility, and you do yourself a great favor in terms of spine. And finally, in terms of rehabilitative exercise, what we do now, and we've added a whole new division to our office for that purpose, is that any joint that was damaged or injured, once we have done the chiropractic and restored it to position and used the nutrition and healed the ligament, so now the joint integrity is there, many times if we want the person to feel 100% and be able to maintain 100%, we want them to be stronger. Because those areas, by the way, when we diagnose somebody's bad shoulder or bad back, we test muscles, and what do we find? Some of them are weak, right? With every one of you we've tested that are patients here, we test and find out which muscles are strong and which ones are weak. Well, after we've done all our work and put things back in place, wouldn't it be good to take the weak muscles and make them strong? And the principle for that is use them, right? You got to use them. So we have a very advanced system here, if you want to do it the most precise way, where we have computerized muscle testing. After we finish the chiropractic work, we can take a computerized system, test all the key muscles of that area, find out which ones are strong and exactly how strong, which ones are weak and exactly how weak, and custom make a training program over in our rehabilitative exercise area, where between very specific weight stack machines that are designed for neck and back, because we got a lot of stuff for neck and back you won't find in the gym, and rubber band systems which have these rubber tubing hooked up to different attachment points where you can work a shoulder or a knee in every different angle. And we've got all that over in our rehabilitative exercise division, so we can take you from, now we've fixed the tissue, now let's strengthen the muscles, get rid of the last amount of pain, restore all the motion, restore all the strength, and have the thing really at 100%. Well, tonight's topic, I wanted to cover a lot with you. Let's see if we can just recap. I wanted to make sure that we covered how to really keep a spine happy. because, you know, you can have your mouth rot out and it'll cause you a lot of grief and a lot of hassle, but if you let your spine or hips rot out, you're going to really be an unhappy camper. Because they really aren't replacement parts at this time. You can't order them from catalogs. They won't just install new discs and you come out happy. They won't put in new vertebrae when there are spurs on them. They can't take people with these spurs in their necks and do a surgery and take the pressure off those nerves and they come out okay. I've never seen a patient ever come out okay from those surgeries. I've always told them not to do them, and some of the bullheaded ones go ahead and do them, and then they come back a year later crippled every damn time and tell me they're so much worse. And what can I do at that point? I mean, you don't want to do, I told you so. You just go, I'm sorry to hear it, you know. What are you going to say at that point when a person's made a really stupid mistake and the surgeons botched them up and they can't fix them? Because those neck surgeries are a nightmare, and we can save people from those. If you understand the underlying structure and physiology of the body, it all becomes pretty logical, just like anything else in life. If you built spas or you built computers, if you understood what it took to put the thing there and what can go right and what can go wrong, you can do sensible things. But if you don't understand the logic of what these things are made of and what they take to be built properly and what they take to operate properly and to maintain them, you find they fall apart. And unfortunately, when these things fall apart, they just aren't easy replacement parts to order. You end up being just a real unhappy camper because ongoing pain and ongoing numbness and ongoing muscles that don't work, legs or arms, nerves that are pinched that go to digestive tracts or female systems or wherever they're going that cause the kind of problems they do, that's just not worth it. And that's why I think this topic is of utmost importance. It may not perhaps be the most fascinating plot you've heard. It may not be as interesting as the latest scandal in Washington. But in the end, some of the things we talked about tonight will have more impact into how you feel when you're 40 and 50 and 60 and 70 and 80 and 90 years old than all the silly stuff you read in the newspaper every day that doesn't have any application to most of us in terms of how we're really going to experience our quality of life. Hope you had fun tonight. I want to let you know, for those of you that are new here, that we gave each of you some of these health passes. You can use those yourself, and they entitle you to come in for free and have us test you for free, find out what problem areas you have, want to run a free 10-point examination on your problem areas, shoot one free x-ray picture of a problem area that you have, and tell you what we found and let you know if there are things that you need fixing up, what they would be, and what's the least expensive way to go about these. These are good for those of you that have never been patients. You could meet with Leslie and make an appointment with her to have a free health pass visit. You can give these to friends or family that you think might belong in here. Next week we're going to talk about what? Longevity. Oh, next week we have a seminar called Longevity, huh? Yeah, staying young, strong, and healthy. Next week we're going to go through longevity approaches. How are you going to view the whole area of aging and optimize your health so that you age gracefully and get the advantages of aging without all the real disadvantages? You can minimize those and make aging a better deal and have a happier, healthier life. We're going to go through a real broad overlook of strategies that relate to all of longevity, the whole arena. So that'll be next week, and then a week after that we're going to do nutritional medicine, and we're going to cover how you use nutritional supplements instead of drugs for the day-to-day medicine of life, and how you can use nutrients, which are so much superior. Alfredo was just telling me, you know, that his child who had an infection that wasn't getting better, and another kid with ear infections that weren't getting better, and you know, medically they can put these kids on antibiotics and do surgeries and put tubes in their ears and do all these bizarre and wondrous things. But when they brought him in here and we took a child and put him on the right nutrients, the infection was gone and doesn't come back. But when these kids come in and they are treated with drugs and they take antibiotics, and then the infection's back 3 weeks later and they give them a different antibiotic, and then they come back a month later and give them a different antibiotic, they're not fixing the problem, because drugs by and large don't fix problems. They cover up problems. And they create new problems because they all are toxic and they all have side effects. So when we go through nutritional medicine, we're going to go through how you can use nutrients to deal with day-to-day, regularly encountered, the most common problems patients bring into me in this office all the time. We're just going to go through this problem, you use that, and this problem, you use that. And how you use nutrition to be your best medicine instead of drugs. Hope you all had fun tonight. Glad you made it. We'll call it an end of tonight's seminar.